56-year-old male presents with diabetes mellitus, diabetic neuropathy. Patient comes in following an insulin-resistant talk at Kessinger's Cervical Chiropractic Clinic. We brought people in and we said, hey, we're going to tell you about insulin resistance. And then we explained how it works, what it is, and where it comes from, and what we need to do to resolve it. He stated that he had diabetes for approximately 10 years. His blood sugar levels are never below 200 and are usually above 300. Just as a side note, they found the New England Journal of Medicine has published 2 studies showing that the more tightly you try to regulate your insulin, the more it's consistent with dying early and having problems. And the reason why is because the insulin, up to a point, becomes even more toxic and more caustic to the body than the blood sugar itself. So they find that if they ease that up and try to keep it in the 150 zone to 180, it's much healthier for the patient than trying to really ratchet that thing down and keep that blood sugar down into the about the 100 mark. Of course, the best thing is get to the root cause of it, and I like what my dad used to say. He used to say that he felt like diabetes was not should not be considered a disease, but a disorder, because it's completely reversible. And I can attest to that. We've reversed this on many people, and it's what a wonderful thing, because when a person is diagnosed with diabetes, this is just statistics. These are just statistics. That person is said to that they will live a third less than they were going to live, and they're going to be more beset with problems like kidney problems, maybe blindness, even amputations and different things, because of all the damage. Because diabetes, when it comes down to it, is an inflammatory disorder, and it really messes with the small arteries. And anywhere small arteries are there, you're going to have a problem. That's why you have it in your hands and your toes and your eyes and different places like that. Even these people, they say now Alzheimer's is considered type 3 diabetes. So we really need to get a handle on this. And I'll tell you one more fact. They have described that 50% of the U.S. population by the year 2020 will be either diabetic or pre-diabetic, and that just blows me away. Now we're seeing kids used to never get type 2 diabetes. Used to be, people turn 25, 30, or you'd see it really happen around 40 or 50. But now we have children that are 8, 10, and 12 years old developing type 2 diabetes. Now you can say, well, that's because they're just drinking all the sodas and they're doing this, they're doing that, and all the other things. But really the fact is they're doing studies, and they find that how the mother treats herself from a nutritional standpoint, and I'm sure from a subluxation standpoint, how she treats herself during the pregnancy has a lot to do with the sensitivity that cells in the body, particularly the liver and the skeletal muscle cells, are going to have to insulin. So the more resistant that you are to insulin, it doesn't really matter what you do until that's corrected, you're going to develop these problems. So I didn't go too far on that. I just want to give you a little heads up that I think it's good for us to understand this condition. And also, keep in mind, I'm an upper cervical doctor, and the foundation of everything we do is our upper cervical. We have to get people clear, no matter what that looks like. We've got to get people clear so they have a free flow of life from above, down, inside out, so the body can act normally instead of abnormal. This is abnormal working, but I think it's good to understand this, because when you're talking to patients out there, believe you me, they want to know that you know what's going on, and they will flock to you when you can produce that and also produce the results. So patient reports that he quit taking anything for it. Man, that's my kind of patient. Tough. There you go. He's going for it. He also reports moderate to severe pain in the right foot, as well as numbness and tingling in toes. Of course, this is the diabetic neuropathy. We did a blood test on this patient. We do blood tests in the office. BJ did blood tests. We do blood tests for the purpose of seeing where people's at, because I love to do upper cervical care and just see what happens after we apply the care. So we look at this as HDL cholesterol is at 34. A man should have HDL cholesterol at least at 40, or it really spells some pretty big troubles. Of course, his glucose is way out. We already knew that. No big deal with creatinine and BU in there. That's just good kidney function right there. The sodium is at 133. That is a huge amount of adrenal fatigue. Well, adrenals and blood sugar, they're cousins. They work together. So if one's out of order, the other's got to be out of order. So this is actually going to be a good marker to see if the patient's getting better after we apply our care. So the chloride is low. That's another symptom of the adrenal fatigue. Man, he's got it bad. And look at this hemoglobin A1C, 9.9. That is off the charts. You just can't live very long keeping that. And the liver enzymes are a little low, so he's got some liver congestion, some other stuff. So basically, that's what we're looking at right there. Let me look at the uric. Okay, we're good there. Then it's ferritin. This is iron storage, but when somebody's in bad trouble and they're in a free fall of a chronic degenerative disease, a lot of times you'll see that ferritin bump up over 500 and more. So this is really not a great sign for this guy. It does not look good here for the home team. So anyway, he comes in. We do the HRV. This is for the adjustment, and look how low that autonomic nervous system index is. And that's lower than 20. That's almost not breathing. That's really bad. And his balance is so bad that it won't even show up on this graph. I mean, it does. There's no category for it because his autonomic nervous system is working so low, it won't even pick it up. It won't even measure it. So this was May. Look at this. Now I'm going to back up and say, look at this. This was February of 2011, and this was May. Look at the change, and I got to tell you, this guy got his life back. What did he do? He did two very simple things. Some people don't like it, that we advise this, but guess what? It was part of saving this guy's life. One thing is we got him under upper cervical care, and he basically stayed with it, and I put him on a very basic, what I call modified paleo diet. Basically got him off of grains, got him off of junk food, had him make sure he was eating meat and vegetables and really nothing else, and the guy complied with that very well. And so that was all we did. We just got him off the grains, we got him under upper cervical care, got him clear, and just a fantastic thing happened here. And as you walk through this process, you can see where his weight went from 255 down to 222. So he lost 30 pounds. He wasn't trying to lose weight. He was just simply eating right, and he was losing weight. Also, I think it has to do with the fact that getting clear will affect the body's ability to regulate the insulin better. And when you have so much insulin pumping out there, it increases your insulin resistance, which is going to hold on to the weight, so that alone is going to help him lose weight. So there's a lot of issues going on. His urinalysis, we were doing urinalysis on him. Anytime, you're not going to see glucose or sugar in the urine unless it's actually at 180 or above in the blood. In other words, if somebody has a blood sugar of 150, it's not even going to register on the glucose in the urine. So you see the first few times, February 7th, February 10th, February 17th, he had blood sugar in the urine. I'm sorry, he had sugar in the urine. And then after that, of course, that dropped out. And you can see how a lot of these other things really, really got better through the process, which were, really very, very happy for him. He had a good result there. And so let's see here. Okay, let me back here. Foot pain. You can see this is him writing his notes each day, and basically he's just talking about how his blood sugars come down by itself. It's in the zone of about 100 to 120 by itself. Here's what our adjusting chart looked like. It's kind of funny, but this is how I do my charts. Here's my pelvic balance, 12 millimeters short left leg on the left. In his patterns, I found 5 breaks. You'll learn about this when you go through the pattern analysis and pattern analysis workshop. So I have 5 breaks in my pattern, so I know that each time I see him, that's the breaks I'm looking for. So I'm going to come through here. We did an ASL adjustment. I grade my adjustments 1 to 5. If I feel like it was a really excellent set, couldn't be better, I call it a 5. If it was a really good solid set, I'll call it a 4. If I'm just fairly impressed with it but not impressed that much, I'll call it a 3. And if I feel like it was a push and a shove, I'll give it a 2. If I don't feel like I get a good set, I'll do that, and so on and so forth. So very interesting. Down to July 25th, 2011. Things were sailing along pretty good. His foot was feeling pretty good. Things were going pretty good. After that adjustment, and there's 2 weeks later he came in, he said his foot started tingling again. All the diabetic neuropathy signs came back. And what happened in retrospect is I simply adjusted him when I should have really waited. I mean, that happens. And so I adjusted him too early. It looked like he was in pattern, but I really should have let it go. And because I adjusted him at the wrong time, we didn't get a good set on it. It actually returned some of the symptoms because guess what? I put him in subluxation. But then, of course, a good thing, we got it back in shape the next time. That's the reason why I tell patients this. I say, they said, Doc, I don't want to come back to you because I hurt after the last time I see you. my response to that is you should be running to me so I can, if I did screw something up, I can fix it. I know I'm trying to be funny, but it really is true. So, okay. As of 8/22/11, blood sugar levels averaging between 100 to 110 with some readings in the 90s. This is remarkable. No more pain in the right foot. Tingling. That's after the bad adjustment. He got back on track again, by the way. But anyway, tingling in toes of right foot much improved. Energy level much improved. Sleeping much better. And look at this. This was I believe that was the first one. See this February 7th. That's what we're looking at. Look at that hemoglobin A1C at 9.9. Sodium at 133. Look at all that triglycerides. And okay, so that's just a blown up view of it. 9.9, 133. You can see all that. And this is the post right here. Hemoglobin A1C down to 5.8. Do I hear a cheer? Anything under 6 is considered normal. I like to actually see it under 5.7, but I'm not going to complain too much about that. Look at the sodium. 136 is still a little bit low because sometimes those adrenals get so wiped out it just takes time for them to rebuild. It doesn't, it's just a process. So 136 is much better, but it's still a little bit lower than it needs to. Of course, you can see the glucose is low, the HDL cholesterol's come up. So everything looks like it is much better. He's not just telling us it's much better, but the HRV looks better. The blood test looks better. His readings are looking better. He's feeling better. This right here was what I would consider to be a very successful case. That's the reason why I'm going to show it to you. Here's the sodium is 136. Look at the hemoglobin A1C. What 5.8? It was 9.9. I'm just going to tell you something. You cannot live very long with a hemoglobin A1C, or you can't live very long very good. And I would say, and I told this guy when he first got started, look, you got to get serious about this. You got to make sure you keep your appointments, make sure you're staying clear, and stay on that modified paleo. I mean, you need to stay on that. Stay away from the grains. You got to get serious about this, because I said if you don't, looking at you right now, this does not look good. And I don't know. I'm not your creator, so I don't know how long you're going to live. But I will tell you this: it does not look good if you don't make some changes.